So hi guys, my name is Ralph Krishnalin and I am from BIS and 2C, and today I'll be doing my activity in pharmacology, which is called Explain. So the first question is, tell me what the video is all about. So the video is all about Mike Villeneuve, the CEO of the Canadian Nurses Association, and he shared his story when he was still a novice nurse 30 years ago, where he committed a mistake where he accidentally put more potassium to the high potassium patient. During that time, Nurse Mike had two patients. The first patient has high potassium and the second patient had low potassium. What happened was he administered more potassium to the high potassium patient, and what happened was it almost put the patient's life in danger or maybe die by giving that medication. But what I commended him, what I commend about him, because he did the right action. He called for help. He asked the doctors, the physician, and all the surrounding nurses around him. He also told his head nurse, and I think that's one of the amazing things that Nurse Mike did, because according to him, if he did not tell the truth, then his career would be over by now. He, for him, he is glad that he tell he told the truth about the situation, and what happened was the physician was able to do the right things to do to prevent the patient from dying, and he was relieved that the patient lived. And I think it's one of the commendable things that you have done, being honest and saving the patient's life. That's my point of view that I really like about Nurse Mike. And the second question is related with what have you learned about the video are related with the concepts of pharmacology. In pharmacology, we nurses are the one responsible for administering medications, and in the future we would be handling around a lot of patients, maybe 10 to 5, and having 10 to 15 or more, I'm not really sure, orders of medication. And I think I could relate it with the seven rights of medications, because we really need to put or drill those seven rights in our minds so that we can help the patient, at the same time protect ourselves from failing, because one mistake could end our patients' lives. That's all. Thank you.
Good day, Mr. Candilasa. My name is Liga Claire M. Quizon and I am a second-year nursing student from Section C. I watched the video on YouTube and collaborated with my groupmates in answering the activity given to us. When I watched the video, I began to feel a sense of doubt and nervousness, because in my mind, maybe, and I hope not, that I will also go through the similar experience that Nurse Villeneuve has gone through. And I began to feel a sense of dread as I thought of that. I do not want to commit mistakes because I am handling a patient's life, and any errors could cause some grievous consequences that I would rather avoid. And so what I learned is that it is very important to be cautious given our role as a nurse. In working together with my groupmates, we had many ideas, but we were able to make our reflection from the previous activity into something cohesive and well-written. I experienced a relatively smooth process as I collaborated together with my groupmates. I learned that cooperation, responsibility, and respect is important in order to succeed as a group and to produce a good output to submit upon. I got to be comfortable with my groupmates during the previous activity, so this was a fun and good experience to me. The story of Michael Villeneuve gives me a learning experience. He gave the wrong medication to the patient, and usually, committing errors in our job, especially giving the wrong drug to the patient, could cause some serious complications as a consequence of that. The main theme of Mr. Michael Villeneuve's story was about the medication, and what could happen if we commit an error into giving it out on. In relating this to pharmacology, we commit our hearts to the 7 rights of medication implementation in order to help us avoid on committing errors and malpractice in our job as a nurse. Doing the nursing process properly, the assessment, diagnosis, planning, implementation, and evaluation, being cautious and always double-checking what you are doing and administering to your patients will not only help our patients but also help us a long way in our job as a nurse. Thank you for listening and watching to this video. Have a good day.
According to what I've read, to the last group activity, which is about the documentations of Mike Villanueva, the CEO of Canadian Nurses Association, I've learned that we nurses or student nurses should be more responsible in giving medications to our patient. We have to ensure the right medication administered to the correct patient, and also know the limits of your knowledge, skills, and judgment, and also seek for help if needed. And also, if something triggers in your mind, if something's wrong, it would be probably wrong. And if with that, stop what you're doing even for a minute and think it is true a second time. Which you have to think it twice. Double check the medications, double check the items or everything. You have to be ensure everything, and you have to be more careful and be sure, because health is wealth, to avoid dangerous also. This article with the best examples relate pharmacology, in which it fits the 7 rights of implementation of administering a drug or medicine to the patient. It will serve as our guide for do's and don'ts on applying a proper and a safe nursing intervention to the patient. We have to drill it in our mind, the 7 rights of implementation of administering a drug, because it will help our patient as well as nurses. It will protect us from malpractice also, as well as that. Because we all know that one mistake can end our profession as a medical professions. Just be a responsible nurse. That's all. Thank you.
Module 2, Activity 3, Explain. Upon watching and comprehending about the previous activity with my groupmates, we learned about the experience of a novice nurse who accidentally switched the drugs of his patients, and we also learned how he coped up and managed his situation with the help of his co-workers. We also learned that communication is vital when errors occurs, because it helps in tracing back the problem or why did the problem occur in the first place. This is crucial in maintaining proper patient care. I will use that information to serve as a lesson for myself, because as a student nurse, I will be on duty soon, and sometimes we cannot predict errors or outcomes. May it be giving the wrong medications to the patient or giving the wrong care that the patient needs. This information may help me in dealing with those problems in the future. I also learned that in the healthcare community, they help one another. They are a team. So this gave me an overview that I should always trust them, and for sure I should always trust myself. I can relate it to the current concept of pharmacology through the nursing process, and how nurses provide healthcare from assessment to implementation. Thank you.
Hello, good morning. I am student nurse Perchan Baldos, and today I will share to you what I have learned and experienced from the previous activity with my groupmates. We brainstormed our ideas about the video, and after watching the video, we shared how we felt. We felt scared because it could really happen to any one of us, and we all commit mistakes, but as a nurse, we should always recheck what we are doing to be safe, and if we commit one, we should directly tell our clinical instructor or the chief nurse to save the patient. We shouldn't be afraid to admit our mistakes because life here is at stake, and it is important to prioritize the health of our patient. And when we go on duty in the future, we should always trust our instinct, or when in doubt, we should always recheck the medicines that we are going to give, because how could we provide effective care to our patients when we gave them the wrong medications? And it is our responsibility to always think of our patients' safety. I could relate the information I obtained in the implementation part on the nursing process, because we have there the 7 rights, where there is the right to medication, where it is important to read the medicine label on the bottle. We should always practice doing this to provide the correct medication to our patient. I will use the information I obtained by applying this to myself in the future. I will make this as a lesson learned to always remind myself to always be cautious and alert, and to always recheck the medication before administering it to the patient. If I commit a mistake, I will tell directly the clinical instructor or the chief nurse to save the patient. And not just the right medication, it is important to practice all the 7 rights in the hospital so that we can give the best care we can to our patients. Thank you.
So, hello guys, I'm Daryl the Budabul. So, the question first is, what have you learned or experienced from the previous activity with your groupmates? So, my experience when making the group task is difficult because first we should watch the video and then share your thoughts about the video that I seen. And the video is all about the documentary of the CEO of the Nurse Association in Canada that is named Mr. Mike Villeneuve. I also finding a hard time to communicate with my groupmates due to the internet problem, but fortunately, my groupmate understand and helping each other to create the group task and pass it on time. So the second question is, how will you use the information you obtain relate it from the current concept of pharmacology? I will use the information that I obtained to the video and relate to it. The nursing process and pharmacology is the 7 right of distribution of medication to the patient. I learned that administering a medication to the patient is very important because not only good for the patient, but it's also for us, it is our responsibility and also to protect our medical career. As Mr. Mike, he is responsible for his action. He shows honesty, and that is also important for us, the future nurses. So that is the information that I obtained, so it will serve as a guide for do's and don'ts and applying a proper and safe nursing intervention for the patient. So those are my feedback and information I obtained from the group activity. Even though this pandemic, it is very hard for us, but we still managed to create it and pass it on time, and that's all.